What's up, guys? How's it going? Cade Moore with More Muscle, and today I want to talk to you guys about something super interesting. And I want to read you guys this fact, right? So it says in 1999, the Institute of Medicine's IOM seminal report, "To Err is Human: Building a Safer Health System," shocked the medical community and the public by revealing that medical errors were responsible for at least 44,000 deaths per year and possibly as many as around 98,000 deaths annually. So, guys, that means preventable deaths happened because of the healthcare teams, right? I am in the healthcare field. I want to help people. I want to help people get healthier, right? That's what I want to do. But one thing you guys, if you're in assisted living, if you need to get medication, you need to check your medications. You got to have some knowledge about it. You got to know that these types of drugs can have interactions with other types of drugs. Um, and then let me finish. The IOM categorized the medical errors that occurred while providing care to clients as mistaken client identification. So basically, they didn't know, they gave pills to the wrong person or whatnot, or they did a treatment on the wrong person. Restraint-related injuries, wrong site or wrong client surgeries, adverse drug events, client falls, suicides, and adverse drug events, right? So guys, this is sad to say because as healthcare workers, none of us really want to, injure someone, obviously. I'm currently trying, I want to become a doctor eventually. But also, a lot of healthcare workers, they work 12-hour shifts. They work 20-hour shifts. And by the end of their shift, they're tired. They're not thinking correctly, right? So that means we all need to have a little bit of education on drugs, what they're taking. So I think before you take a drug, or if you're going to do a surgery, read through the informed consent. Sorry. And read the symptoms of certain drugs that you're taking, and also research this adverse effects. Right? These are really important to do because it can save your life. And even over-the-counter drugs that you can go get at Walgreens, those can be very, very dangerous. Taking it, in high amounts. There's a drug called acetaminophen. If you go above 3,000 milligrams per day, that can be very harmful, right? And that's in a lot of over-the-counter drugs. So if you're taking multiple drugs, this could be very, very harmful to you. But what I wanted to really focus on is the next thing, right? So this is something that's pretty crazy to me. It says the United States spends more per capita on healthcare than any other country worldwide. So national healthcare expenditure grew 4.6 to 3.8 trillion in 2019. So guys, that's a lot of money. And that's a lot. And hear me out, guys. If someone gets sick and they've taken care of their health their whole life, they've done their best taking care of their health, okay, let's help them out. But if you have a 500-pound patient that comes in and they're having hypertension, they're having heart problems, and then it's just hard to help those type of people that haven't taken care of their health, because they're 500 pounds. Obviously, their heart's going to be under a lot of pressure. They have hypertension, of course they do. They're 500 pounds, and that's even if you have a BMI over 25. BMI is like your percentage of fat, right? So anything, you want to stay around 18% to 25%. That's a healthy range. But if you're above that overweight range, that's not good. So $3.8 trillion in 2019, guys, that's going to be growing. And it's supposed to like in 2028 it's supposed to reach 6.2 trillion, guys. And a lot of it's just, we're eating junk food. We're not exercising. Life is just so easy that we can be sedentary. We don't need to hunt. We don't need to do the things that we used to do. and our bodies are having all this excess calories, and it's just not good for our health. So this is the thing, guys. If you have worked your hardest to take care of your health, go to the gym, eat healthy, not take out, drugs, get outside, doing things that are healthy, eating, sleeping good. If you've done that your whole life and then you get sick and you need help from the medical field, then guess what? Every single person in the medical field is going to be happy to see you. They're going to want to help you, right? But if you are way overweight, if you've been smoking, you've been drinking alcohol, you've been eating junk food, fast food all day, you're not sleeping good, that's your fault. That's preventable, right? And the problem is what we're trained to do is give out drugs, drugs that can be very harmful to our bodies, right? That's what we're trained to do. If someone has hypertension, guess what? We give them a drug that lowers their blood pressure. If someone has heart disease, we give them something like digoxin or something that helps their heart pump more efficiently. But guys, remember, your body has this thing where it's always regulating, right? And so say, for example, if you lower your blood pressure, your body's going to have some adverse side effects. That's what happens. So it's a temporary drug that might actually even do more harm at the end. So guys, what I'm trying to say is take care of your health. Do the things that are good for your body. Don't get obese. It's easy to stay in good shape. It really is. Just buy healthy food. If you eat healthy food, if you're not eating added sugar, added oils, added processed flours, you will not be fat. It's not possible unless you have hypothyroidism, but that's very, very unlikely. So if you're not eating these junk foods, and I promise you guys, at one point I was a little bit obese. I was probably about 27% was my BMI, or 28%. Not super obese, but I had a little bit of fat on me, and I started eating healthier, started working out every day, and all my health problems went away, right? And I started exercising every day. Exercise is so important, especially if you have mental health problems. Exercise will take care of those, and I'm serious. It happened to me. It might help you. Exercise. Go outside. That will help you. But anyways, this is what I'm trying to get at. $3.8 trillion. A lot of that stuff is preventable. A lot of it's preventable. Everyone's gonna die at one point, but you can if you're healthy and you're exercising, you're gonna have way less symptoms. You're gonna have way less heartache, and you're gonna be healthier. You're gonna be able to move at the end of your life, So all I want to finish with is take care of your health. If you still have problems, then go take some drugs. For example, if you have type 1 diabetes, I'm okay. I would love to administer insulin because you don't have insulin. Insulin doesn't function for you, right? Your body's not producing insulin, right? But if you have type 2 diabetes, that's reversible. That's reversible, right? So if you have type 2 diabetes, it's hard for me to give you insulin because if you were taking care of your health, you wouldn't have type 2 diabetes. So it's really simple. So guys, take care of your health first. Do all that you can to take care of your health. If you're still sick, then go to the hospital, go to the medical, then go get help. Go get medical help. But if you have taken, if you've eaten junk food your whole life, if you haven't slept good, then you're going to have health problems. This is going to happen. Maybe, if you're 20 years old, if you're 19, it won't happen for, 20, 30 years, but it'll catch up to you. I've seen it. I 100% have seen it. I've worked 2 years, almost 3 years in the medical field, all over, ER, bunch of different places, and I've seen it. It's not fun. It's really tough when you have a 50-year-old that's overweight and that's having a heart attack. That's not fun. Or they're having they have super high blood pressure, and that's from lots of unhealthy choices. So anyways, guys, thank you for watching. Subscribe if you want, and just remember, take care of your health first, and then if you still need help, okay, You're going to go to the hospital. You're going to go to the ER, whatever it is. But take care of your health first. And it's not that hard. You could honestly, it takes 2 hours, maybe an hour, a day to take care of your health. 15 minutes to prepare healthy meals, and 30 minutes of exercise, and 15 minutes you go out in the sun. You get your vitamin D. That's all it takes. And just sleeping well, going to bed. It's not, it doesn't take, it's really easy. And every time you go to the store, don't even touch the junk food. Just get the healthy foods. That will save you the most. That's the easiest decision you can make, and that's going to benefit you the most. Anyways, thanks for watching, guys.